Hello and welcome to the Doctor's Corner. I'm your host as always, Dr. Mark Pinsky, and today a very familiar face, Mr. Mark McCoy. Mark is the Vice President of the United Trainers Association and the medical, we'll say director. I'll be the medical director. You're the director.
Yeah.
The director of Pinsky Wellness. Mark has been here, as I said many times before. Today, a little different twist. Mark will ask the questions. I will answer the questions, all related to nutritional supplementation. Thanks, Mark.
So, thank you.
Good to see you, buddy.
Yeah, thanks. All right, guys. So first and foremost, I just want to ask you the question. I mean, obviously, we talk about this stuff all the time.
Right.
We're on the same page and everything.
Absolutely.
But the big question is, why are you utilizing now the IDLife platform, knowing that you've been doing this for many, many years?
Right. So this is a really big thing to come along. I mean, I've waited 24 years for this, to be honest with you. We have done a lot of things together, but there's always been this huge void. There's always been, how do we get our nutritional advice across, but do it succinctly, because time is really of the essence. And most of us, to be very frank with you, don't have my background and don't have the ability necessarily to give nutritional advice. So IDLife has provided a platform that allows us to do that better than anybody.
Awesome. And does that also help with compliance on the product?
For sure. So one of the things that we talk about is when they do their HIPAA compliant assessment, that really is customized and catered to them so that there's an ability for them to realize, I really do have these needs and I really need to do these things and fill in those gaps in order for me to function at optimization level.
Brilliant. Yeah. And I'll share with you guys this little tidbit. And I'm not sure you remember saying this the way you did, but it hit me like a ton of bricks that you said that this was not competing with what you've done for so many years. It literally became your third-party credibility because you've been saying this to them.
Right.
And they don't always follow the advice.
Right.
But then all of a sudden, it was said again.
Right.
And it was so dialed into what you were teaching before, but it was like, by the way, yes, and yes, and yes, these are so key.
Right.
And expound on that a little bit, the detail of what you get when you take the assessment.
So when you do the assessment, one of the nice things from my perspective is they're covering things that I wouldn't have even thought of to cover, right? Environmental issues are huge, and they cover all those questions. We may cover a little bit of allergy, but they cover a ton of that. And there's just a lot of questions that personally, for an 8 to 10 minute assessment, for them to get all of that information would take me way more time to do. And I don't think I would really do nearly as good a job and get to that. So when you present it to the patients, as I do, you don't have to do that. I mean, if the doctors don't necessarily want to do that, they just want to have them do the assessment, they can be rest assured that that assessment is really designed at a very high scientific level to give their patients what they really need. I just like to take that step a little bit further and say, hey, listen, because I'm your doctor and I've taken care of you for such a long time now, and I've now completed your wellness exam, which is usually when I do the assessment, that we can fill in gaps, and I may add, I may subtract, I may do a bunch of different things and really customize it even to another degree higher than even what IDLife might recommend. So for me, it's been an absolute huge game changer for me to be able to provide that fill-in-the-gap support. Because, let's face it, the nutritional supply is horrible. Nobody knows that better than you.
Yeah.
And so the bottom line is this allows us to be rest assured we're giving them a solid nutritional platform, an all-natural, organic product that they can rest assured has gone through all kinds of quality assurance. And I think that that's really all we can ask for.
Absolutely. Absolutely. Okay, so let's ask the question here. The consultation's one part.
Right.
There's the advanced level of the DNA, and
Right.
I mentioned a lot of that in health seminars and things that we talk about, that the DNA level is telling them at that code level what those influencers could be and stuff, and you love that added depth.
I do.
And it's not a necessity?
No.
It's not?
No, but I'll tell you what I did. So when I first did mine, I'm going to tell you why I think I encourage them to do it. I don't need necessity, but it's going to take you to another level.
Yep.
Okay, for sure. So I did my DNA right out of the gate, but I had already started my supplementation and then had to go back after and fill in what the DNA told me.
Okay.
So I learned a ton just from my own error, if you will, by allowing them to say, hey, listen, if I were you, I would do the DNA right from the get out. We can click that box and says, hey, yes, we have your DNA assessment. They'll link the two together, and we'll get a much better readout of what you, based on your own DNA, nutritionally would need. And we can also base a program for physical exercise based on that DNA. And I told you this, I wish I had that 20 years ago. Yeah. Not that I'd become Hulk Hogan, but I would have been better than I am now for sure. Yeah. And just in the 7 months that we've been doing it, from my perspective, I have, my body's definitely changed.
Fantastic.
And it will continue to change.
Fantastic. So you have that personal experience. You're speaking from your heart when you're talking about stuff.
For sure.
And one of the things you mentioned in that one, again, when you did the assessment, you got your nutrition vitamin system first, started on that. You did the DNA and got the results a few weeks later.
Right.
And all you had to do is go back to the assessment, you click edit. So this is what he was sharing with me and how simple it was at this. Right. And you just click on the DNA symbol in the bottom, it takes you right to the last page, plug in the 6 markers, and then it tweaked your program.
That's awesome.
Super simple, guys.
It's super simple. It's
love
really
this
awesome.
System.
Yeah, really awesome.
Awesome. Okay, so thank you for that. And let me just add this extra question here. The HIPAA compliance, the safety, it's at the medical level. You've got all these details now lined up, and this is just plug and play for you as a business. Right. So you no longer spend this hour and 15 minutes you said you used to spend with a client to go through all this stuff and get all these data points to figure this out and go with it. And in addition to that, the staff calling the pharmacy and double checking contraindications to medications and all that side. I love the conversation we had about that. Right. But the big thing here is now that you've streamlined this, how has this affected your time in the office and your daily activities?
Well, so for me, it's allowed me to do things that I love to do because it's coordinated with my weight loss program and it's tied in directly to the program. So it's allowed me to even venture out further and do things in health and wellness that I just didn't have time to do.
Right.
You just don't have time to do it. So from my perspective, streamline, create a higher level of care, ability to take care of patients in a way that, we did a good job, but now we can even do it better. And, I'm always looking for that edge to take care of patients. And I think that is what we're here to do,
Yeah. So you were telling me it takes people only 8 minutes on the iPad. So you set your front office up with some display, just some posters. You've got the TV up there. Right. You've got the iPad on the display unit. Right. So they could sit there in 8 minutes, take it, and they actually walk in and show you the results rather than you spend an hour to get to the results.
That's correct. So then that's where we really make those changes. So I don't have to go through that whole first phase. I know it's already been done for me, right? And now the patient's ready because they know it's coming. They know that conversation's coming after I complete their wellness exam because this is supposed to be a time for me to set up their plan for the year. Set up what we're going to do, how I'm going to take them and either keep them well or how I'm going to get them well.
Right.
And so that's the whole design. And this is a huge part, which nobody really can offer. And so even before, let's just say I'd asked those questions for an hour. What did I have to offer them? Had to offer them a bunch of products from a bunch of different places, or it was very, very difficult to get them on a full program, which they could really, hold their teeth onto, and then go to make changes to that program. How are you going to do that? Very difficult to do. Yeah. This makes it very easy to say, okay, well, we got you here, and we did well here, but what's missing? And so maybe a few months later, I bring them back, and then we tweak it. We change it, and it's worked out very, very well. There's not a person who I've done it with who's not elated about what we've done.
Excellent.
It's really cool.
Excellent.
It's
really
good
feedback.
Cool. Yeah, it's really, really
cool.
Yeah, it's really cool.
Very nice. Okay, so you have this system in place. You've got this plug and play protocol. The marketing and the ability to operate this into your business.
Right.
I've already mentioned in the business seminar the 3 touch points of social media, just making announcements and just simple like, wow, hey guys, here, hit the link. We've talked about the newsletters, and I know you sent out your first newsletter. Tell us about your experience with that.
Well, the first newsletter that went out, we were fairly new into understanding how it even worked. And even with that, I have a very small practice, as you know, Mark. I only have 450 patients in the practice, and 10% of those actually answered that. So 43 patients responded to that assessment.
In what time frame?
It was like less than 48 hours.
Oh, wow.
It was very quick.
I didn't know that.
It was very, very quick. And we just sent it out again. We tweaked it a little bit, changed it a little bit based upon the feedback we had gotten from the patients. And so it's been very well received. Again, I don't have the final. We literally just sent it out 2 days ago. So I'll find out what the results are on Monday. But I do suspect that we will get a very positive response. We've been talking about it now. People are seeing it in the office. People are asking me questions. And of course, during this time of the pandemic, everybody's interested in keeping themselves healthy, or if they did not, is now talking about getting themselves healthy. So it fits directly into our philosophies.
Excellent, excellent. I go to a lot of medical offices. I consult with a lot of different people. So one of the things I've noticed, I can walk in and they'll have a room full of a brand of supplements, or they'll have a product area that has a multitude of brands. And I've talked about brand mixing and the safety issues there. But tell us what you used to do, and then what do you see different here?
Well, about 20 years ago, I had my own weight loss program and branded my own product line. And that was a little bit problematic because there was a lot of waste involved. And then after that, there were other companies that I had done business with, and we followed sort of that same model where we had product in the office. With IDLife, I've streamlined it in the sense that one of the great things is I can just have samples for the patients to try, so that at the time they do their assessment, they may want to do those things. Like, for example, I can give great advice on some of those products because I've done them. The sleep product is phenomenal. Yes. It's one of those really great products that's time release. It really is one of those things that helps you get to sleep, get to a deeper sleep, come out of it. So in the morning you feel great. So I can talk about a lot of the product now, and I'm streamlining. The DNA kit would be the prime one to keep in your office. Maybe a kit or two. You don't have to keep a lot of inventory, so you're not out a lot of overhead. And it really is the overhead that kills you in the small business world. So we've streamlined it to what we think will be a big winner, and we think that the DNA is definitely a big winner. Sleep is what everybody talks about. So we've kind of geared ourselves in that direction. Energy will be another one that we'll probably carry in the office, because that's things that people talk about on a regular basis. We have not done that yet, but it seems to be the way it's going when we do the assessments. So if you don't want to do it in the beginning, I get it. If you don't have to, but you can talk and see where your particular practice takes you, and then you can have a small amount of inventory and not enough that it would be problematic for you as an expense. One of the things I wanted to say before is this is probably one of the few times in medicine where you're actually in a win-win, right? Because you're always trained to help, right? But in this crazy world we live in, we have to also think about how do we also get back, right? Because we got to pay staff, we have to pay our overhead expenses, and so in this scenario, the win is we're giving patients advice they're never going to get. They're going to go to crazy stores and they're going to get advice from a 16-year-old, and they're not going to be able to get what we give them. And then on top of that, we're actually going to be compensated for the hard work that we've done to learn how to make this a real positive experience and a real uplifting thing, a foundation up approach, if you will, for patients to really benefit. That's what we're really designed to do. That's, as physicians, what we're really supposed to do, in my opinion. So this has been a real wonderful venture for me. I've really enjoyed it, Mark. And I know it's just the beginning. This is the very tip of the iceberg for what the company has laid out. They have done it right from the get-go. There's no turning back. And they are on the right track, and they're listening to what we're talking about. They're hearing people like yourself who've taken care of high-end athletes, and they're listening to professionals like me who've also taken care of high-end athletes, but are dealing with large populations of people, all different, diverse people. So they really are paying attention. I have really the utmost respect for the company. They've done a nice job.
Fantastic. Yeah, me too. So let me ask this question here. So the platform itself, having the broad reach that it does, the plug-and-play version that we're talking about, this digital nutrition world that we are now in this paradigm shift moving into. I mentioned in our other video that it's like the Blockbuster to the Netflix version of
for sure
proactive supplements and programs. Right. How do you see this going over the next 10, 15, 20 years?
I don't know that we've even uncovered where that's going to go.
Yeah, it's hard to predict.
Because this thing is, you and I sit in a think tank all the time, and this thing really has a chance to just explode from all aspects. I believe that the company will probably realize that beyond the United States is where they're going to go.
Sure.
I believe they'll venture in the continental North America first, and then they'll expand their way out. Mm-hmm. So I think that there's no telling. That's the exciting part to me. I mean, there's no telling where this thing could go and how great the products are going to get. And the company's 6 years old now. Yeah. And so I do envision another 10 years from now, the product line will be unsurpassed by anybody. I really believe that. I think this is we are going to experience one of the greatest transitions in all of healthcare. I believe it.
I'm right there with you. And I would like to ask, looking back 10 years from now, if somebody doesn't take advantage of the opportunity, do you think they would look back at this and go, I can't believe we ever had blanket approach nutrition. Yeah. Look what it is today.
I think for sure they're going to do that. Right. I mean, I am not one of these people that like ebbs and flows and does, you know me. Yeah, so it's taken me a long time to come on board. I have to do it myself. I have to do my homework. I have to believe. Yep. And so I got to tell you, I am definitely a big believer in the quality of the product and the amount of time and effort the company has spent to make sure that they have provided science. Mm-hmm. And to me as a scientist, it doesn't get much better than that. Huge. Yeah. And they won't compromise. They're never going to compromise that. They've made that very clear from the get-go that they would never compromise. Yeah. And I believe that that's 100% true. All right. Thanks so much, Mark, for coming on the show. Always an incredible, enlightening experience. And I actually like the reverse role. I got a chance to take a break today, so I really enjoyed it. If you have any questions for Mr. Mark McCoy or myself, you can reach us here at drmarkscorner@gmail.com. That's drmarkscorner@gmail.com or pinskywellness.com or pinskyweightloss.com. We look forward to your questions, and of course, future episodes will be more than happy to share whatever your questions are and our responses. Until next time, for Mr. Mark McCoy, Jeremy Gonzalez, executive producer, I am Dr. Mark Pinsky. You've been watching The Doctor's Corner. This is Dr. Mark Pinsky once again, asking you to forward questions to us, whether regarding this episode or any of our past episodes, at drmarkscorner@gmail.com. Also, don't forget to check us out on our website, pinskywellness.com or pinskyweightloss.com. We look forward to hearing all of your questions, and we'll get back to you as soon as we do. Y'all have a great week.